The last few months of pregnancy is a very exciting time for you. Your body will be changing and your baby will be growing and getting you ready to join your family. I'm here to talk about some of the common symptoms you may experience later in pregnancy and some things that you can do that can help your body manage and prepare for birth and beyond. It's important that you try to keep active, as exercise is beneficial to you and your baby. Backache is common as your abdomen gets bigger and hormones work to relax your ligaments in preparation for birth. Ensure you avoid heavy lifting to protect your back. Gentle walking, yoga or swimming are great ways to keep you healthy. Pelvic floor exercises are important to continue as the increasing weight of your baby will put additional strain on these muscles, and keeping them strong will help prevent issues with bladder leakage after birth. You can find information on exercise in pregnancy on our website. You may experience a number of common discomforts in pregnancy, such as nausea, food cravings, tiredness and difficulty sleeping, reflux, constipation and hemorrhoids, varicose veins, and probably many others. We have information on our website on ways to manage these discomforts, but if you're worried, talk to your doctor or midwife. During your pregnancy, you will get to know your baby very well. You will notice your baby's individual pattern of movements when he or she tends to be active or tends to be asleep, or even if your baby gets the hiccups. Getting to know your baby is important so that you know when to tell us if you are worried. It is not normal for a baby's movements to slow down in preparation for birth, and we know that the majority of women who have experienced the rare but devastating event of stillbirth report a change in baby's movements within the previous 24 hours. This is why we will want you to call us immediately if you notice a change in your baby's normal movement pattern. Do not wait for the next day. Do not drink cold water or have something to eat. Just call us. A midwife will talk to you over the phone and most likely invite you to come into the hospital for a checkup. It's okay if this is in the middle of the night. If you are worried, we are worried. We will be encouraging all women to go to sleep on their side from 28 weeks onwards, as we know that going to sleep on your side means that the big blood vessels that supply your placenta with oxygen for your baby are wide open and ensuring optimum oxygen flow to your baby. If you wake up on your back, don't worry, just settle back on your side. Again, we have a number of links about reducing the risk of stillbirth on our website under the Normal Baby Movements While Pregnant tab on our website. Towards the end of your pregnancy, your body will undergo some changes in preparation for birth. The baby should move more deeply into your pelvis, making breathing much easier. You may notice an increase in vaginal discharge as your body produces hormones to soften your cervix. You may even lose a plug of mucus that has been sitting at the entrance of your uterus. This mucus may sometimes have small streaks of blood and is often referred to as a show. You may also experience some painless tightenings of your abdomen. If they come and go or disappear with movement or rest, they are most likely Braxton Hicks contractions and not causing your cervix to dilate. If you're not sure, again, please call our midwives for reassurance. We would encourage women to think about what might be important to them during their labour and consider writing them down in a birth plan. Like many journeys, sometimes plans need to change unexpectedly. Your labour and birth may not go to plan, and you may need to be flexible with any plans you make. Prior to birth, it is important that you are prepared to bring your baby home. You will need to ensure your baby has a safe place to sleep, you have an approved car restraint installed into your car, have a bag packed ready for hospital with clothing for you and your baby, have your pregnancy paperwork and know the number to call when you are in labour. There are a few reasons other than labour that would be important to call us, and some of these reasons include if you think you are in preterm labour, that is before 37 weeks gestation. If you think your waters are broken, especially if the colour is stained green, which means that your baby has had its first poo inside, or if the water is blood stained. If you have any bleeding from your vagina that is not mucousy but more like a period. If you have abdominal pain that is not coming or going. We would encourage you to talk to one of the midwives so that they can decide if you need to come to hospital for an assessment. Most women will go into labour naturally between 37 and 42 weeks of pregnancy. We would not recommend induction of labour until 10 to 14 days beyond your due date, unless the risk for you or your baby continuing your pregnancy is greater than the risk of induction of labour. If your pregnancy lasts beyond your due date, your doctor and midwife will discuss additional monitoring for your baby, such as ultrasounds to measure the level of amniotic fluid around your baby and fetal heart rate monitoring via a CTG machine. a cardiotocographic machine. We hope that you can relax and enjoy this exciting time before this incredible life-changing event. Know that our doctors and midwives and the whole women's health team are here to try and make this a very special time for you and your family.